So, an at home COVID test, most of the at home tests are rapid antigen tests. And with the amount of COVID transmission we're seeing in our community right now, a positive test is very likely a true positive. That probably means that you have COVID. And so you need to self isolate, stay home for 5 days, um, continue to monitor for symptoms, but stay home and then inform other people that you may have been around in the 2 days prior to your positive test that they may have been exposed because you potentially could have transmitted to other people. But I would consider that a positive test. So if you've been exposed to COVID and have a high risk exposure, particularly like a household member, then a at-home test, if it's negative, it may be negative, but one of the challenges with the at-home test is the sensitivity is just a little bit less than the PCR test that you get at walk-in clinics and other places. And so it is still possible that you could have COVID. Now, if you don't have any symptoms, it's possible that you just monitor for the time period that you would for isolation afterwards. So you make sure that you're still being careful because you potentially could have COVID. You could also consider getting a PCR test as a backup, and that's in package insert if you look at those at-home tests. If you're still concerned you might have COVID, it is possible to have a false negative with an at-home test. So we're still learning a lot about this subvariant of Omicron, BA2. It has been nicknamed stealth Omicron, which I don't think is a very good nickname. That's related to some PCR tests and how they detect Omicron. But it does not really impact the more important things that we want to know about. Does it have any difference in clinical manifestations, severity? Is it more transmissible? Are there any differences with vaccine protection? All of those things we still don't know. I will say that it's very closely related to Omicron, the predominant strain that we've been dealing with. And so it's likely that there aren't significant changes similar to what we've seen with different variants because this is a subvariant. It's actually very closely related to Omicron. So if there are differences, they're more likely to be slight differences than the bigger differences we've seen between the different variants. I think if you've had Delta and Omicron, part of the answer of do you need the vaccine is in that question because if you've already had both, it shows the main issue is that you can still get reinfected, even with a natural infection. And so if you had both, there is a potential, unfortunately, unlucky as it sounds, that you could get another variant moving forward or get reinfected with the same variant if enough time passes. What we know about natural immunity is it does provide some protection, but for a very short time period. And the protection doesn't seem to be as strong as the protection that we see with vaccines. The protection from vaccines also lasts longer too from the studies that we have so far. So we're still learning a lot about long COVID. It's also called post-COVID conditions. Generally, the definition that's used by the CDC is when people have symptoms that last for 4 weeks or longer after their initial symptom onset with COVID. And it covers a broad range of symptoms, both physical and mental. Common ones that you've probably heard about are fatigue, brain fog. Some people have some ongoing shortness of breath when they're doing activities or cough. And there's a whole host of a long list of other symptoms that people can have with long COVID as well. The first thing to do if you think that you might have it is to talk to your doctor, talk to a primary care doctor, because the first thing they need to do is to make sure that there's not another reason that you might not have that. And during this COVID pandemic, some people have not had as much opportunity to see their doctors for regular checkups. And so they may have things like uncontrolled diabetes, uncontrolled high blood pressure, other things that can cause some symptoms like fatigue. And so you want to make sure that those are addressed first. If your primary care doctor doesn't find another reason for it, they could look at referring you to a long COVID clinic. And there's more of those coming up as we're trying to learn more about this syndrome. There's also ongoing research into long COVID, so we can learn more about it and the best ways to manage it. This question's come up quite a bit, right? Because a lot of people have had COVID and may not have been vaccinated yet. So the CDC's recommendation is that you should wait at least until your symptoms have improved, you're back to baseline, and you're outside of that isolation time period, so you're not transmissible risk to other people when you go to get your vaccine. That being said, there's probably some protection from natural immunity for a couple of months afterwards. What I've advised and recommended to many people is to wait about a month. That gives most people time to get back to their baseline, and you're still within the 2 to 3 months of protection that we think people have after a natural infection, so that you get that vaccine protection, which will really boost the protection, the lower level antibodies that you get from a natural infection. Fortunately, most people that get COVID have milder disease. And so they can be at home, they should be self-isolating, but it's really important to monitor symptoms. Warning signs that you may need higher level of care if you have shortness of breath, if you have chest pain, if you have new confusion or changes in how you're thinking, if you have a family member that's having difficulty with COVID that's unable to wake up or stay awake, those are all warning signs. And really, any other severe symptoms or signs that you see might need to be seen by a primary care doctor or even seen in an urgent care clinic or ER, depending on how severe those symptoms are. Certainly, you should contact your healthcare provider, your primary care provider, if you do have COVID and you have any questions so they can help with that. Fortunately, most people can manage this at home, but it is important to continue the symptom monitoring to look for those severe signs that might say you need to go to the ER. We're still learning about Omicron because it's a newer variant, and so we'll need more time to see some of the long-term consequences. But at this point, all signs would point to it having the same risk for long COVID and the post-COVID conditions as the other variants. We haven't seen significant changes other than increased transmissibility, relatively milder acute courses compared to Delta and some of the other variants, but the risk of inflammation still remain. And some people with post-COVID or long COVID have those symptoms even after very mild or even asymptomatic COVID infection. So signs would right now point to the fact that it's probably the same risk with Omicron as the other variants, but obviously we need more time after this Omicron has become known to us, discovered, to see what that's going to show us long-term what those risks are. This question has come up quite a bit, vaccines and fertility, and it was a reason some people were concerned about getting the vaccines. Fortunately, we have more information now. There was a large study that was performed on 2,000 couples out of Boston University, and they looked at couples that were trying to get pregnant. And these couples were both vaccinated and unvaccinated, or maybe just one partner was vaccinated. And they followed them for a long period of time. And what they saw was that there was no difference in the couples that were vaccinated or had one vaccinated partner to unvaccinated couples and the ability to get pregnant. There was no fertility changes. Now, what they did also note during this study was that in male partners, if they'd had a COVID infection in the 2 months prior to an opportunity to conceive, there was decreased chance of getting pregnant. And so there is some decreased short-term, but there is some relative short-term decreased fertility for male partners that get COVID infection. And the best way to prevent COVID infection is to get vaccinated. So in a way, we kind of learned a little bit more about both sides of that question by seeing what happens in this 2,000 couple study. On a related note, there are other issues that have been looked at in relation to sexual health with COVID infection. And there was a study out of University of Florida that showed that for men who have acute COVID infection, afterwards, they are 3 times more likely to be diagnosed with erectile dysfunction than men that don't have COVID infection. And there's some reasons that can explain that as well. They have found that COVID, the virus that causes COVID, can also bind to receptors in the testicles and penis, and it also impacts blood flow to that area. So there's some physiologic reasons that would explain why they found that. They're studying this more, but obviously there are some concerns that having COVID infection can impact sexual health. Even more reasons for couples that are interested in getting pregnant or concerned about fertility issues to consider getting the COVID vaccine.